Right, afternoon everyone. Something a bit different now. So my name's Ian and I'm from the University of Manchester, and I work with the researchers at Salford Royal Hospital who are doing research into systemic sclerosis. So it's a bit different. So I'm going to start you off. I'm going to give you some background into some other imaging techniques we've been doing, and then I'm going to tell you about a pilot study that we did using multispectral imaging, but for whole hand images. Okay. Okay, so systemic sclerosis, it's a connective tissue disease and it's characterised by skin thickening and changes to the microvascular system. So these changes to the microvascular system affect blood flow, so you get this blood flow dysfunction in the skin and in the internal organs. So if you look at the picture in the top left here, what this is a picture of, this is a digital ulcer, which is quite a common symptom. So these are caused by a lack of good blood flow and by dilation of the capillaries, which is also what you can see in the second image here. This is a man on his face. This is what are called telangiectasies, which are dilated blood vessels, which is another symptom. So there's some research going on this. It's got the highest mortality rate of all the rheumatological disorders, mostly because of its internal organ involvement. And we're making steps to do non-invasive imaging using the skin, because what happens internally is mirrored by what happens to the skin. Okay, and currently there's no cure. There's just the treating symptoms. You see the hand on the right. You can see there's patches of white and more red skin. If we can create a score for this, then we've got a more quantitative measure and more sensitive than you are. So first we started doing single point spectroscopy. So we had a halogen lamp, an Ocean Optics USB spectrum bifurcated cable, and it looks like this. These are pretty good bits of kit, these spectrometers. They give you good spectral resolution, but if you're just using the end of the fibre to deliver and collect the light, there's a couple of drawbacks with this, a couple of limitations. One is that we know the effects are going to be heterogeneous across the skin, so measuring a small area might not be the best measure, might not be representative, and also it's quite difficult to get the same amount of signal back into your fibre, which then creates other problems. So they were doing this, but then we're doing multispectral imaging. So this is very similar to what we were talking about earlier. We've got a liquid crystal tunable filter and a CCD, and then we're illuminating the whole hand with big halogen lamps. So this is a side-on view, so the camera's pointing vertically down onto a tabletop, and the patients will put their hand under the camera, and we've set up the lights symmetrically about the camera because we need to reduce shadows in the image, which is some of the considerations that it's quite different to the length scales that you're measuring. And that camera, we didn't build that came from Channel Systems in Canada. Okay, so we used the software that came with it, and we scanned through the 500 to 710 nanometer range, taking images every 5 nanometers. And this tunable filter's got a 7 nanometer bandpass. So with this, we scan all the wavelengths. We've got a set of data to work with. So mentioning the clinical trial, so we're doing whole hand imaging. So we had 10 healthy controls, 10 patients with limited systemic sclerosis and 7 patients with diffuse systemic sclerosis. And what we did, we had them, they came in, no caffeine, or there's other exclusion criteria prior to their visit, and then they're kept in a temperature controlled room for 20 minutes. So one of the big symptoms with systemic sclerosis is Raynaud's phenomenon, where they will have, because of poor perfusion, get very cold hands, sensitive to the cold weather, so we have to keep them in 20 minutes in a temperature control room for measurements. And then we take a measurement at baseline, and then we're using a pressure cuff to occlude one of the fingers. So after a minute and a half of occlusion, the ring finger or the middle finger if that's not available, we take an image, and after 2 minutes of occlusion, we release the pressure in the pressure cuff, and then we're hoping for a hyperoxic reaction afterwards. So we're looking for increased signal, and then we take images at 1 minute and 5 minutes after that. Okay, so this is what our images look like. These whole hand images. So at the top line, you've got your healthy controls. So your baseline image, during occlusion, you can see in the finger that's been occluded, you've got a big decrease in signal. At release, then we get this increase in signal above baseline, and then this tends back to baseline over the next 5 minutes. Things we notice just from the images is that you get in your health controls, you get quite a homogeneous reaction over the skin when you compare this to your health controls, where the changes you get aren't as great, and you can see that they don't affect the whole of the finger. So where you've got this reperfusion, it's on a sliding scale of how well you can measure this oxygen increase once they've reperfused. Taking a close look. So this is what the images look up close. So these are quite noisy images. So health control, drop in oxygen, increase. You can see here we've got a decrease for this is a diffuse patient, and then we've got areas that increase in oxygen better or worse. So erythema is the other thing we wanted to look at. So we wanted to look at erythema mainly as an indirect measure of perfusion, so we can correlate this to results that we already have. So we wouldn't expect any change during occlusion, but at the release occlusion, then we expect to see an increase in signal that goes with the reperfusion. And again, in your patients, this is the immediate release and 1 minute later. For a healthy person, you can see that it's dropped back down to a normal level, and the signal's pretty constant over the finger. Whereas if you look at, this is immediately after releasing one of the patients, you've got areas that have, they've not got the same signal throughout the finger, okay? And then this is 1 minute later and there's no real change. So qualitatively, the images are interesting. For a more quantitative measure, we then took an average value over the finger that was being tested. All groups decrease and then increase, but what we saw in our patient groups is it goes along with what else we know about this blunted response. Okay. So, and then we've got, it's a statistically significant difference between those two measurements for the two different groups over those minutes. For erythema, again, you can see that the health controls have a very consistent pattern compared to the other groups. We lose this trend to varying degrees. Overall, we've got a statistically different response to the protocol, but this is a pilot study, not a huge data set. Okay, so in conclusion, that we showed from this small pilot study, we can actually use multispectral imaging to look at the differences to health controls of patients under test. This is now part of a longer, ongoing study. Hopefully we get some more images, more sense about what we're seeing. Okay. So I've talked really, really fast through my presentation, flew through, but just like to acknowledge my supervisors and the staff at the hospital that work with my patients. Thanks.
Thank you very much. Any questions?
Yes.
What do you think the crosstalk is between perfusion changes and oxygenation changes?
In terms of